we're just right in time for some questions. Yes, Andrea, please.
My first question would be to Marcello, I think. You mentioned that for the e-prescription, there is this mapping between the countries, then this standardized medication list, and then to the other country. And of course, my question would be, how do you validate this mapping? Because if there is some error in this mapping, this can have, of course, quite some unfortunate effects for the patients. So from my feeling is this brings the mapping engine a little bit in the area of a medical software, because it's quite relevant that the mapping is really correct, right?
Yes, in fact, the entity responsible for are the National Competent Authority for Drugs. I mean, we are not doing the mapping as e-health entities, but since the National Registration Agency for Drugs must transform the old database into the new data to be fed into the EMA Sport system, we are taking exactly what they are producing, cleaning, etc. So we are not doing the mapping. They are doing the mapping because it is their task. As it is responsibility of EMA of providing the mapping between the RMS internal code system and the DQM, because it is not up to the member state to do that. And in fact, we are pushing in order to get this certified mapping between the internal code and the international code system. On the same side, we are asking to the different agencies to provide the coded data. And in the prescription, there are different level of structuring. I mean, it is allowed to provide structured textual data in order to describe, even if the full set of the attribute has to be coded. However, there is still the possibility of providing textual parts. So for the medication that have not been already transformed, mapped by the NCA, this way of providing the textual structured part is still allowed. And it is a sort of intermediate step, because for solid medication is easy, tablet pills, but when you enter in very complex preparation, etc., with several active ingredients, etc., it is hard. And of course, the National Health Agency doesn't want to take that responsibility. And you are fully right.
You can stay there and ask. Yeah.
Other question?
We still have another one for you mentioned, I think, if I saw this correctly on your slide, also collaboration between ISO on the IPS, on the further development of the IPS, and I see also Robert here in the room, of course. The IPS is, of course, not only an ISO standard, but it's a whole suite of standards, the IPS, which is now coordinated by the IPS Coordination Committee of the Joint Initiative Council. I was just wondering, is ISO the right level, or shouldn't it be the IPS Coordination Committee?
I will ask Robert to give the answer. We are open to cooperation.
Well, actually, there's two members of the group already participating in the IPSCC. That's Hinek and Daniel Carlson. So they are represented at the IPSCC level, and we are in direct contact with Europe to also see if they can provide input on all specifications to the IPSCC. But there's a lot of internal alignment going on. First, and I'm happy to hear from Marcello that there is now a joint initiative between the EEHRxF or the EEHRxF network, I should say, subgroup, and EEHR to make this happen.
In fact, Daniel, as co-chair of the EEHRxF Network on Semantic, is also one of the task leader or co-task leader in VP6. So we are strictly working. When I was saying the right hand goes together with the left hand, I was thinking to me, to him, to Hinek, etc. Because we are a community and we are not lobotomized, hopefully yet.
Are there any more question, discussion? Well, thank you very much. I would like to thank the experts for their positions and for your questions. And I look forward to continuing this discussion in the closed sessions tomorrow. Thank you all for being here. Thank you.